Imagine a form of healthcare that is entirely focused on the patient, where the first goal of treatment is to do no harm, where safe and natural therapies are used to tap into nature's incredible healing power, and practitioners are focused on getting to the root of what's really going on with your health, where the doctor functions as a guide and mentor, treating you as a whole person, body, mind, and spirit, while also teaching you practical tips on how to prevent health issues through lifestyle adjustments and natural therapies.
You're listening to Take on Healthcare with Ted Suzelis and Mary Sheehan. Ted is a naturopathic doctor who has been helping people in Northeast Ohio for over 20 years to live a happier and healthier life through natural healthcare, including dietary advice, vitamins, herbs, and other natural substances. Mary is a full-time pharmacist who also helps leaders in healthcare suffering with anxiety and depression integrate the best parts of traditional and alternative medicine. Have you ever wondered about natural medicine but aren't sure where to begin? There is a lot of confusion around alternative medicine. We can help. In today's podcast, we break down the basics of naturopathic medicine, how it differs from other forms of alternative medicine, and how you can find a qualified practitioner.
I sometimes wonder what it would be like in this country if we didn't have to explain to people what naturopathic medicine is, because everybody already knew, because that was the main form of medicine. Like the system was a naturopathic medicine system. And then I'm like, well, that would be fun. Then we'd have doctors on explaining things like prescription medication and surgeries and things like that. But we don't live in that world. We live in this world where the dominant system is allopathic medicine. And so I guess that gives us the opportunity to come together and talk about naturopathic medicine.
Yeah, wouldn't that be crazy if we had to then explain to somebody why they need to get a whole colonoscopy? They've never heard about that before. And we're going to shove up a camera up their butt and get a colonoscopy.
Yes. And the MDs and the DOs are on the fringe.
Right.
Wouldn't that be weird?
That would be weird.
I love to think about stuff like that. Like if the world was upside down. I blame Stranger Things.
I mean, I feel like it is upside down at this point because
it is.
The dominant medicine of the day before allopathic medicine took over was, in fact, natural medicine.
We are in the upside down.
Yes.
We're already in the upside
Except
down.
I don't have as many psychic powers as I want.
Yeah.
Right.
Well, that's a whole
Keep working on it.
Different topic.
I'll try.
All right. So then I would like to, on that note, because the systems are so different, I'd like one of you guys to explain the body as a whole, because in our current dominant allopathic system, we kind of tend to view the body not as it is in reality. Like you need a heart doctor and a bone doctor and an endocrinologist, as if the systems are not connected. And I feel like people know intuitively that the systems are connected. At least pharmacists do, because chemistry kind of goes everywhere. But the allopathic system tends to separate things out. So I think body as a whole is something good to remind the people about.
Sure. And the body as a whole, really, I mean, there are separate components, but they do have like a nature that all works together. So you have the physical body, which, yes, has those different parts. You've got heart and brain and lungs and, endocrine organs and digestive system and muscles and fascia and all that kind of fun stuff. And there's a lot of things we can do to kind of work on those parts of the body. But like you said, even pharmacists knowing that they're connected
By chemistry,
they are physically connected. If you look at fascia, I mean, the whole fascia system is
we
totally
don't look at fascia in our system.
Right. But that's the beauty of naturopathic medicine, is that we do look at things like the fascia. And I think that there are more clinical research studies coming out and different things showing that, there is some validity to the fact that if you have a pain in the back of your neck, you might actually have something going on with your foot.
That's outrageous, Dr. O'Connell.
Outrageous.
But I think you need then just define fascia for us, because again, like even... Okay, I'm a pharmacist and I don't really, I kind of know what that is, but because we don't work with it and we didn't learn about it in school.
Right.
Tell us what it is.
So fascia is basically, it's the envelope within an envelope of connective tissue, kind kind of like, this is a little bit graphic, but when let's say you're pulling apart a chicken, when you peel that meat away, you see the thin layers in between. Well, we have that too.
Through the whole body.
Through the whole body. And it kind of roots down. It's called the root of the mesentery, where your guts are connected to your spine, basically, your spinal column, your bones and everything. But all that stuff, it all comes out from when you're formed in the womb. You start as a little tube, and then you go bloop, bloop, and you come apart into all these different envelopes.
All the parts are connected.
They're all connected. Physically connected. So I don't think most people know that. I know. It's wild.
It is.
So, you cut or injure any little part of that, and it sends some level of signal throughout the body that things need to change or be healed, which is a really great, part of the naturopathic understanding of the body healing itself, and that it does send signals that way. And that's part of that whole physical body. But part of the physical body, too, is the spiritual body, the soul, the mind, everything that goes on that we're thinking about and feeling, and how we connect with other people. Community is incredibly important. When I work with my patients, a lot of times it's like, okay, we've talked about the physical. What's going on in your life? How are you connecting to your kids or your wife or your husband or your family? Or, if somebody lives alone, like, how do you go out into the world and speak to others? Do you help others? And so there's like a lot of things we can go off of with that, the spiritual, mental, emotional body. And those things are connected. The reason why the placebo effect has to be beat in clinical trials or in drug trials is because it's 40%, at least 40% effective. That's really effective. Yeah. So, so saying the placebo effect, people go, oh, and they dismiss it.
It's just so great, the placebo response. I take advantage of it all the time in the pharmacy. You should harness that.
Yes.
Like, we're just throwing pills and bottles at people and say, good luck to you. Like, no, let's take a moment to say what a miracle this chemistry is.
Yes.
And it's going to do wonderful things for you. And you're going to do your part. It's going to do its part. Mm-hmm. Yeah. I love the placebo response.
Yeah.
Well, speaking of, you did mention that the body can heal itself. I would like some evidence for that.
Yeah. So I love to talk about this topic because so many of the detractors of naturopathic medicine, when they're talking about naturopathic medicine and trying to show why it's not valid, they talk about our principle of the healing power of nature. Mm-hmm. And
we being nature, humans being nature.
Right, right. And they say it in a way that naturopathic doctors, we believe in some kind of pagan witchcraft, that this is just some kind of magic that we try to use to heal the body. When in fact...
that only you have access to, apparently.
Exactly.
Yeah.
Right.
The wizard.
Yes. Naturopath is wizard.
Yes.
Yeah.
But really, the healing power of nature is a very simple concept.
It's innate.
Yes. It's our bodies have the ability to heal themselves when we give the proper nutrients and environment. So I like to joke with about MDs, and sometimes actually use the healing power of nature more than we do. Mm-hmm. Because say you break your arm, you fall and break your arm, what do? First thing you do, you go to the ER, you get an x-ray, and if the arm is broken, they put you in a cast, make sure that the bones are aligned, and let you go on your way. And let the healing power of nature take over, because your bones are meant to heal themselves. So
imagine.
Right. Imagine.
No, but that is really interesting.
Yeah.
Because imagine then if, okay, somebody sets my leg, and then I said, well, what are you going to do to heal it? And the emergency room doctor says the body will heal itself. And then someone says, that's an outrage. The body doesn't heal itself. You're right. They do. Right. They do say it.
Yeah.
So it's interesting. It's not that they don't, like an individual doctor, traditionally trained doctor doesn't know that. It's just not part of their system.
Right.
They don't bring it into other facets like a naturopathic doctor does.
Right.
That's such a great example.
And it's just about, really, it's about defining it properly. And but when we look at naturopathic medicine, if that same person breaks their arm, we're going to do more probably to support the body in that process. We want to make sure that they're getting enough calcium and magnesium and vitamin D and vitamin K, boron, silica, all of these different nutrients to make sure that that bone can optimally heal. So like I said, sometimes the medical doctors rely on that more than us. And another good example is somebody gets a virus and
they get a Z-Pack. I see it every day.
Yeah. Or whatever, another
Makes
antibiotic
no sense.
and a steroid.
Oh yeah,
And
steroids all the time now. Yeah.
And neither of those is going to
For a
actually, heal that virus.
Correct.
The antibiotic will, a lot of times antibiotics will have some anti-inflammatory effects, so they'll get some benefits there, but it won't kill the virus. But it also might make sure that they don't get a secondary bacterial infection. And then the steroid, it suppresses your immune system so that it's not overacting, so that your body can take over and heal that virus.
Interesting. Okay, I never really thought about it that way. So you're saying the steroid, you did say the steroid suppresses the immune system. Like
Right.
I always thought that would be a bad thing then.
Well, it calms it down. So like during COVID, with that
Good example.
Yeah, with that whole cascade of symptoms that would happen, the steroid could calm down that cascade so that the body isn't moving out of control and could actually heal the infection.
Okay. And we are going to talk about suppression, which is
Right.
like my favorite topic. So I won't get too far ahead of that. But I also want to go back to the dominant system not emphasizing prevention. Early detection, yes, but in some instances, but not prevention. When I think of preventing disease, I often think of naturopathic medicine. Again, it's a systems problem. So let's talk about prevention.
Sure. So with prevention, and the way I look at prevention, I think other naturopathic doctors look at prevention. In a way, it's kind of like, you're almost ensuring that your personal business model is going to be diminished somewhat because you're trying to keep your patients out of your office in a way. Because the whole point of prevention is so that a person, let's say it's a mom, that mom is going to know how to take care of herself. She's going to know how to feed her body, and exercise and sleep and get clean water, and get a spiritual practice or a community practice or something where she's filling her cup and, replenishing what her body needs so that she can take care of her little kids, train them on how to do the same thing to take care of themselves and prevent disease. And she's going to help her husband, depending on the roles in the household, that varies. But, maybe she shows him recipes how to cook so that when she's doing this, he can cook, or vice versa.
That gives me chills. It kind of it feels so true.
Mm-hmm.
Like the woman as in charge of the medicine, food being medicine, in charge of the well-being of the household. And even in my practice, I would tell the people, especially during the unprecedented times, if all of the women just left America, the men would be dead in 6 months. And they would laugh because they knew what prescriptions their husbands were on.
Yeah.
But the way you say it is so beautiful. It's like you as the naturopathic doctor guiding her or him, it doesn't really matter.
Right.
But the guiding and the education and the making sure she's well.
Right.
It's just it's so beautiful. And then that person is
it's
taking
about
care of
nurturing.
Yes.
Yeah. So
I love that.
So, there's obviously definitely different roles depending on the family unit or how they want to operate, which is totally fine.
Sure.
Because I've definitely taught men how to nurture and care for their families because they took on more of that role. But I do find in practice that I do see more moms that tend to nurture and, they build up the home. They might even still be working a full-time job, and they're busting their butts, just trying to keep their family from getting sick because that affects them as well. And then they stay home with the kids and, whatever the case may be. And, but just seeing people working on the general level of prevention for disease for their families, it's really, really it's cool.
It is. And it's so fundamental.
Right.
And that's what I did when my kids were little. Like I made sure that we had kind of the basics covered, but people weren't really talking about it like that.
Right.
I just knew that that's what needed to happen.
Yeah. And with that same kind of vein, prevention is really making sure that the pillars of health are being supported and maintained so that, because when the body is well supported, it will not have, let's take cancer for an example. We have childhood cancers and all kinds of other things, and a lot of that can be attributed to environmental and stress and like maternal environment. But setting those things aside a little bit, somebody who's fairly healthy, if they maintain, good nutrition, they're not eating processed junk, they're not eating excess calories, excess sugar, they're exercising even moderately, they're getting plenty of water, plenty of sleep, and they have a good community, built up for themselves, and they have interaction with other people. Those people, their immune systems work really well to get rid of cancer cells, because cancer, everybody has a little bit of cancer.
Yeah.
All the time.
Right. All the time.
And so, your immune system goes, oh, that's cancer. Let's get rid of it. But when you start breaking down those pillars, then the body's like, I'm tired to deal with this cancer. And then it just lets it go.
Right. And when we're talking about that too, we're not talking about prevention as a way to totally eliminate your risks.
No.
Because some risk factors are stronger than others.
That's right.
We have certain genetic risks for, say, certain cancers.
Right.
And you're not going to be fully able to get rid of those risks, but we want to do what we have.
Yes.
Take control as much as we can to help eliminate and minimize those risks as much as possible.
That's right.
And I think people don't even realize they can. That's what I love about what you just said. Like they don't even think about it like that. Like there are things I can control and they're basic things. And we're just kind of so caught up in the chasing around the disease and the stress and we don't even think about building the solid foundation of our families, which is the most important unit. We just don't even think about it.
Right.
Yeah.
Yeah. There's, like I said, there's certain things we have a lot more control over. So
control what you
type
can.
Type 2 diabetes, it's a lifestyle disease. If for 99% of people, and I'm making up that statistic, but
you're not far off.
No,
I don't think.
But if you keep a healthy weight, eat healthfully, and exercise, your risk for getting type 2 diabetes is very low.
Right. And that is actually a way to reverse it.
Right.
Because I've had so many diabetic patients who say, you're really telling me I can reverse this?
Okay, why is that a shock to them? But this is why Ted and I love to talk about systems.
Yeah.
Because it's kind of like this kind of marketing brainwashing thing has happened.
Right.
I don't think it's natural for us to have thoughts that we're helpless, that things are hopeless, that there's nothing I can do.
Right. So what I find is a lot of the doctors, whether it's a primary care or an endocrinologist that's in the kind of American Medical Association bracket of things, while they mean well, I think they don't trust patients to make changes. And that is commonly what I see, because I have an example of a patient that I have who they see they're a little bit older, closer to 70. They've had type 2 diabetes for quite some time. When I took over this patient's care, they still see their primary care. They're on Medicare, so they have to do that, which is fine. But I've given this patient many things to say to their primary care to say, like, look, I want to do this. I'm trying to do, time restricted feeding, which a lot of people call intermittent fasting, but they're working on that and they're doing a good job. And they're like, look, I need to come down off these medications. And in the state of Oregon, I'm allowed to take this patient's medications down. So that is something that I work with them on directly. But they get very confused because their primary care says, no, you need to keep taking these insulin-like medications. And I'm like, don't do that, because when you're fasting, you're going to die. If you take too much and there's no one around to help you, you're done.
Right.
And that's interesting. So you're saying that there's a disconnect. The physicians have a distrust of the patient.
That's right.
And that is so interesting to me because it goes to the nature of the relationship. The very nature of the relationship is one of, I tell you what to do and you listen. And like a belligerent child, you probably won't.
That's right.
So then I'm going to have to do this, this, and this. And then we kind of have this kind of dance.
Right.
Which to me is not sacred.
It's not. But
healthy for
I
anybody.
will say, at least for everyone who's heard that first part of the story, this patient has come down off of most of their medications. They've lost that middle section body fat that, increases risk for heart disease and everything else. They feel better. When I first started seeing this patient a couple years ago, they were very cognitively all over the place, couldn't really follow what I was saying, had very difficult time answering questions, and now they're sharp, just super sharp and doing great and feeling better. And then they ended up bringing one of their daughters in to see me, and now I'm helping her too.
That's awesome.
I think that's interesting too about the mind-body connection. Like if your body feels really bad, it's hard for you to be mentally sharp. So then I sit here and wonder, the traditional system with all the medications and the side effects and the no guidance for the foundational pieces of health make people a little goofy mentally. And so it's no wonder the doctors don't trust them to do what, but wow, like it's a vicious cycle.
Yeah.
And my perspective, I think, is a little bit different. I don't know that, at least I'm looking at here in Ohio versus Oregon or Arizona, where from what I see from the medical doctors is it's not even that they don't trust their patients as much as they don't believe that anything else will work.
That is also true.
They have their paradigm and look at health as like a mechanic works on a car. And so things just naturally go bad and you have to either replace them or get some duct tape out to fix it up and just to keep somebody going.
You're like, it matches perfect.
But that is so interesting though too. So it's not that they don't trust them. They're just like, well, they got sucked into something. But that's trust though too. Like in a way, like, okay, so the patient comes to the MD with a plan that involves some things that they're not familiar with and they don't even think it's going to work.
That's right.
To me, that's like a breakdown of the relationship as well.
Right. But I guess on the other side of that too is when most people, when they're doing natural medicine, are doing it all on their own or through influencers online or things like the health food store. And so most of what these doctors see is people are doing natural medicine therapies and they're not helping.
Right.
So these people are wasting their money.
I got you.
Yeah.
Because in Ohio, there's not a lot of naturopathic doctors.
Correct.
So the assumption, of course, would be that's where they're getting this stuff.
Right.
Instead of like, no, I love you, MD. I need you for whatever reason, insurance or whatever, and for medications. Because
collaborating.
Right.
Yeah.
But if they don't even, because I think MDs in Ohio don't even know about naturopathic doctors.
They don't.
What the education
That's
is.
what I'm learning just
what
visiting.
Their skill set is. Like, that's hard for the patient.
Yeah.
It's hard for everybody, really. But I think about the poor patient.
Yeah.
Who's really trying and doesn't want every visit to the MD to be a confrontation.
Right. And that brings up something I see with a lot of patients, since here I need to make sure that my patients have a primary care doctor because
you can't be it.
No, I can't be their primary care here.
Right.
And it's funny because some of these patients, they start doing well, but I'm making sure they go back to their medical doctor to get certain testing and things, and the doctor kind of feels used. Yeah. It's like, well, I'm doing this testing and everything, but you don't want my drugs, so what's my purpose here?
I went to school.
Because they don't get the whole thing. They don't want to be just the person who writes for the tests.
Yeah.
Right.
I mean, not to minimize what they do.
No.
Like I absolutely... A great MD or DO, they're great.
Right.
And I've worked with many that have been amazing.
Yeah, same here. And you have some here that are all on board and they see the changes in the patient and they're willing to do what they need to do.
Yeah.
But others, and I don't know how much of it's the ego thing. And the other part is they just don't understand how we all need to be working together. And they think that it really is a one or the other.
Or it's us against them, and it's not.
It's not.
It's us for the patients together.
Yes.
That's how it always should be.
Right. Always should be, no matter what. Patient first.
Yep.
Patient first. So the next principle Patient first. Is that one of your principles? I don't think it is. But it is in a way. No, not really. Not in those words. But
The principles are patient first.
they're
Together.
Fundamentally, foundationally.
They are.
Yeah. Centric. You're patient centric.
Yeah.
Where are we, Ted? Where are we? Oh, we went into so many things. Naturopathic medicine takes into account the physical, mental, emotional, genetic, environmental, and social factors, which Dr. O'Connell did touch on. And then we were going to go from there, Dr. Ted, to suppression. Is this where you want to talk about, like, let's talk about when a patient presents with an illness? Because we did spend a lot of time like on prevention. So now a patient comes and they present with an illness. Maybe they have an MD. They probably do if they have an illness, a diagnosis. What would be the approach? Because an MD's approach would be, let's diagnose, get the pills, get the surgery, monitor.
Right.
Mm-hmm.
So when a patient comes into my office and does a consult, no matter whether they're coming in because they've already been diagnosed with the disease or just regular basic health care, I'm approaching my visit the same. I first go through and talk about everything that they feel is important about their health that's going wrong. And we talk about that and tease out those details to get a better picture of what's really going on. If they do have a diagnosis, obviously we talk about the medications that they're taking. And but either way, we're trying to understand the whole body and not just trying to put a Band-Aid on the problem, but trying to evaluate what are the underlying issues that are causing this person's dis-ease and making their body out of balance. So with that, we have to really look at a lot of these different factors, whether it's your physical health factors, mental and emotional health. I mean, obviously, some patients, because of physical traumas, mental traumas, will exhibit physical symptoms. There's lots of genetic issues, and this is an area where over the next several decades, we're going to see a lot more information, not only from the conventional end, but also from the naturopathic end on where there are certain people have different nutrient deficiencies that need to be addressed and given more of certain vitamins or minerals or other supplements to help their body to get more normalized.
And whatever normal is for them.
Right.
So it's not like you're saying, I'm giving this vitamin to treat this disease.
No.
It doesn't work that way.
No.
That's green allopathy.
Right.
Oh, that's a thing?
Yeah.
Oh.
Yeah. So that's great. So green allopathy is really...
I had no idea.
Yeah. So it's basically, it's going about and using natural therapies in a allopathic way. So say somebody has depression and they're on Zoloft. So I'm going to take them off Zoloft and put them on St. John's wort.
Yeah.
So that is green allopathy, where you're doing a much more natural remedy, much lower side effects, but it's still just covering the symptoms.
Then what would you do as a naturopath? I think that's a great example that many people can relate to.
Yeah. Sometimes we need green allopathy.
Yeah.
Sure. That's in your
It's
your toolbox.
interventional. It's used to bridge the gap between long-term
I love that.
cure.
Right.
Because it should be a bridge and not a destination for the most part.
Right.
Yeah.
And some patients just aren't there either. I mean, somebody who's older, they've developed high blood pressure, they need some kind of therapy, whether it's herbal or drug-based, to keep their blood pressure under control so they don't have a stroke.
Sure.
Yeah.
And if this patient isn't in a place where they can put all of the effort in to really heal to be able to reverse that, well, then they're going to need to be on something just to keep their blood pressure down for the rest of their life.
Makes so much sense.
Right.
So yeah, we work with that. But as far as a naturopathic doctor, yes, we will probably give certain nutrients, different things for that depression to help get them better. Although for me, here in Ohio, we can't just tell somebody to go off their medication.
No.
You're
So we
right.
have to, so I love that in a lot of ways, because I feel like every naturopathic doctor should have to practice in an unlicensed state, because it really forces you to focus on that basic naturopathic medicine.
Yeah.
Wow,
So,
that's a bold statement.
yeah, because if you are in a state that licenses naturopathic medicine, you do have a lot more higher interventional tools that maybe is a crutch for you.
Yeah.
I get that.
That can
Because again, because
happen.
the system that surrounds you,
Right.
you too are impacted by your environment.
Right.
Just like I'm impacted by my environment.
Yeah.
Right.
I think that's really interesting.
What's funny to me, not funny, haha, but about the whole, like, with the depression and someone who's on Zoloft or whatever the case may be, even in Oregon, where I have full rights of prescribing and everything, when I have a patient come in who does have depression and they're on maybe 1 or 2 medications, SSRI or whatever the case may be, I don't take them off the medications. I start with, hey, let's figure out what's going on under the surface, that pillars of health thing, nutrition being some of the, nutrition, getting somebody to have a nutrition plan that works well for them as a person that they can adapt to and implement in their life and their family's life. A lot of times they're like, I feel ready to come off this medication. What do you think?
Yeah, because rarely does that antidepressant make them feel fully normal.
Right.
There's always
There's a cost. There's a trade-off,
Yeah.
right?
Well, but it not just a trade-off in symptoms or things, but also never fully gets rid of the symptom.
Right.
Well, that's yes. I know. Okay, you're saying it. So they still don't feel
You still
so
might have
great.
some depression and anxiety even on the highest dose of that medication.
Because I was thinking about it like, there's no lows, but there's no highs.
Right.
So they're kind of like in this kind of could possibly be for some people in like a numbed out state, and that would be
Definitely.
the price.
That's more
Right.
often what I see.
Me too, in the pharmacy. Like, so the price you pay for not being depressed is then you don't get to feel
You don't
joy.
feel joy. Yeah.
Yeah.
Or there's
It's
also a lot of
that's a
sexual
price.
side effects because of the
Right
neurological
with joy.
impact
Right. Exactly.
of and that's why SSRIs can be used for nerve pain, because it dulls the sensation of the nerves.
Right.
Right.
And I think a lot of people don't really think about that or know that information. I've told lots of patients like, hey, I'm not telling you to stop taking this medication yet because you're not there yet or whatever the case is. But this is what is probably contributing to your sexual side effects, your lack of joy, your lack of motivation, so let's work on these things underneath. Then we'll get you off this medication. Then you'll feel better. Then it'll compound on itself.
I had once way back when I first started in community pharmacy, a young kid came in, and for some reason people would just tell me things that I think are relevant. His first dose of an antidepressant. What did the doctor tell you? Nothing. And I'm like, why do you think you're depressed? I absolutely hate my job. So, wow, like you guys would immediately be like, okay, there's, that's something to think about.
Right.
And
But sometimes we don't have a choice on that either.
Right.
that's true. But he hates his job. So I'm thinking he hates his job. He works long hours. And what do you think? He didn't know anything about the medication. And so I was just talking to him about side effects. And the one I chose to tell him about was the sexual side effects. And then he just like, yeah, I'm not taking this. And I'm like, oh, I didn't expect that to happen. And the pharmacist I was training under, like I turned around and he's like, yeah, I can't believe you just did that. Like, we don't talk people out of pills here. But he got it. But we really do, I think, need to be honest with
informed consent.
Well, forget about that, sister. Yeah, I guess that's
No.
what I was after. Right.
I will never.
Good for you.
Right.
Good for you. But I guess that's what I was
Yeah.
thinking about. And when I hear naturopathic doctors speak and how much time you spend with patients, really like factoring that in, is a sexual side effect going to be important for this person, I guess is where I was going with that, right?
Right.
And if you've not really spent time with the patient because the system doesn't allow it,
Right.
then we really don't have informed consent.
Right.
That, I guess, is my point.
Right.
Yeah. All right.
Yeah, but sort of pull that full circle, talking about the patient and treating them naturopathically. Yes, maybe that antidepressant does dull everything and they don't feel their depression, but we always have other issues in the body. So they're probably fatigued.
Always.
They may or may not be sleeping well.
Probably not.
They could be in pain. They're not eating well, so their digestion's off. So they have all these other factors to look at. And as you help them to heal and all of these other pieces start falling into place, that's when they start, and sometimes even quicker than they're ready, they say, well, I want to get off that antidepressant. And sometimes you have to say, I don't think you're quite ready yet.
Yeah.
But here's our benchmark for where we can make that happen, and talk to your medical doctor before you're going off of it, of course. But it is just about looking at that progression.
I love how you explain that. And I also think about what it's like for the MD who only has the 6 minutes and they just want this patient's pain to go away.
Yeah.
Right?
They do mean well.
They just want the pain to go away, and the patient wants the pain to go away.
Yeah.
And yeah, it's just, and I think with anxiety and depression, and those numbers I believe are increasing in this country, it's just something that we all should be thinking about.
Yeah.
Other things we can do. All right, where else were we going with this? Let's see. Oh, we went so many places. Do you want to do blah blah? What do we want to do? What do naturopathic doctors believe is the underlying cause of illness? You guys talk about that all the time. My MD friends do not talk about the underlying cause of illness.
Right.
You guys are running around to cocktail parties talking about this
Well, it's very
stuff.
simple. Let me tell you.
Oh,
It's
please.
this. I'm just kidding. Nope.
No, exactly. And that's I love how you phrase that, because that was my first thing too, is the underlying cause of illness. I'm like, wouldn't that be great?
Being born.
We have one.
Madam, you went to such a big place there. Now this show's meta. Yeah, I love that.
But yeah, to have just one single, underlying cause of illness.
But so you don't think there is, because I tend to think of the homeopathic perspective. I think the underlying cause of illness is a disturbance in the life force. So that would be one thing.
The V.
However,
taking it at a very, 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 very deep level.
But that's where I go.
Yes.
However, as the life force manifests in the person, there's other ways to interfere and enhance the life force.
Right.
Many ways to do that, I guess, is how I look at it. And that's where I guess I feel like the naturopathic doctor comes in.
Okay.
But underlying, I believe, it is a disturbance in the life force.
Yeah, imbalance.
Right.
Yeah.
I'm with Hahnemann on the underlying cause of illness.
Good for you.
Thank you, Dr. O'Connell. I really wanted to get that in there.
Right.
That would be dropping the H-bomb, right? Hahnemann, mentioning Hahnemann.
Oh,
my kids will be so
sure.
happy now that I've mentioned Hahnemann in this podcast. All right, continue.
I just want to say something about that really quick. So when I was in naturopathic medical school, Dr. Stephen Messer, who's one of the old school, awesome homeopath guys.
Okay.
Highly respected, really amazing, brilliant man. He always told me, I was in the last throes of my homeopathic courses. And he's like, boy, Rachel, you're going to make the best homeopath. And I'm like, are you kidding me? Why? And he's like, because you don't believe it. And I'm like, oh, okay, I gotcha.
Oh, that's so interesting.
So, I mean, without digging too deeply into that, I respect it completely. And I think what I usually do is if I think, oh man, this patient would be great for a homeopathic
a classically trained,
provider,
perhaps.
That's right. I will refer.
Yeah. Oh, I love that.
Yeah. Because I think that it's so cool when you see cases unfold with homeopathy.
I know. I have seen it in my own home.
I've seen it in front of my eyes as well.
Isn't it amazing?
Yeah.
But we digressed.
Yeah.
Right.
Dr. Ted, back to you.
Yeah.
Underlying cause of diseases.
Yeah. So we have to look at a lot of what we've already talked about. We have all of these different pieces of our health that could go wrong. And that's when I talk about the underlying causes of disease. I'm looking at all of these different factors that we have control over.
Yes.
Not just factors we have control over, but other factors that maybe we don't have control over, to see what's going on and how we can support the body to heal.
Love that.
So obviously, in my practice, one of the biggest pieces is diet and nutrition. And so there's a lot of different parts of that can go wrong. You could have people that are eating foods that they're either sensitive to or allergic to. You could have people that are eating unhealthy diets that are restricting certain nutrients, or maybe even getting too much of a certain nutrient, or just obviously our American food source, a lot of pesticides or other different things that we know just really are not healthy for us that could be causing problems. And aside from that, we need to look at, like we said, the mental and emotional. Has there been some big trauma that could be a part of this? Are there environmental factors? Just like, well, I talked about the pesticides or things like that, but...
or how about environmental factors like what happened in East Palestine? Like
Correct.
Those people are going to be, in my opinion, from henceforth, these people should be treated differently insofar as their health and wellness. Would you not agree?
Right, yeah.
But I don't think that would enter into the allopathic physician's mind to treat them differently, or they wouldn't know what to do anyway.
Well, exactly. They wouldn't know what
But that
to
is
do.
that's a dramatic example, but it's
Right.
a very real example.
Right.
These people are exposed to, we really don't know what.
Yeah.
Moving forward, we don't know what's going to happen.
Mm-hmm.
At some point, I'm thinking someone's going to have to unravel that.
Yeah.
Someone like you or you.
Exactly. And other environmental factors, like I had a patient yesterday who was a new patient and found out that her whole family had tested positive in hair analysis for high levels of arsenic. Well,
Fascinating.
that could cause a lot of different problems in the body. And we need to
Sure.
take care of that.
Do you routinely test for heavy metals in hair? What made you...
This had been done prior to them coming to see me.
Really? They
Yeah.
had that done?
Yeah, they actually had that done. It was interesting.
That is. Okay.
And then, of course, we have genetic factors, some of which we have control over, some of which we don't have control over. And that just made me think of, I haven't thought about this in years, but back to naturopathic medical school. And you have sort of your three legs of health in a stool. You have your genetic, and I can't remember all three of those now.
You brought it up, Ted.
I know I brought it up. But you have the genetic, you have the genetic factors, and you have the nutritional factors, and the environmental factors.
Okay.
So some of these, the genetic factors we have a lot less specific control over, and so that means that we have to focus our environment and our diet and nutritional status to compensate.
But see, this is what you guys say things like this, like it's the most normal thing in the world. And it is.
My husband says this all the time. He's like, you know so much stuff.
Right.
And nobody knows what you're talking about.
But people, here's what I see in the pharmacy.
Yeah.
Here's what I see every day. But that's in my family. But that's in my family.
Right.
Oh, it's no wonder I'm on 15 meds. My grandmother was on
They've
15
chained
meds.
themselves to
Yes.
this.
Yeah.
But they don't understand that genetics are largely influenced by environment.
Right.
That's science. So why science?
But it's not always just genetics either. Just because
But this is what they're complaining about.
Just because your family has high cholesterol, it could be that everybody learns how to eat the same way.
That's
and
madness,
they
Ted.
don't exercise.
Fried
That's
peanut
not-
butter and banana sandwiches, breakfast, lunch, and dinner.
That sounds
and
right.
snacks.
That sounds really good. But people don't. Again, it's the
Right.
programming,
Right.
it's the marketing, it's the way people are taught to think since they're very little. The state of helplessness.
Right.
My father, my grandfather had this, and this. There's nothing I can do about it, and they say it like it's the gospel.
So I'm having a really hard time not putting my tinfoil hat on because so much of this helplessness is really geared toward being dependent on the government to supply every need.
And cut. No.
Yeah, and those things are.
Thank you, folks, for listening.
Right. Those things are relevant, though. Because
we had a good run.
Yeah,
We're done.
But we do have systems in place that create
Right.
some of that effect, and some of it's good, and some of it's really bad.
Right. But it also comes down to the pharmaceutical industry running
Right.
the medical industry.
Yes.
So
And businessmen running the
What?
medical industry.
And so I love watching the newest cholesterol medication, commercials.
Is there another one?
Well, there's always been them, but
Goodness.
and maybe I don't watch a lot of commercials. I don't watch a lot of regular TV. But
I want to see what's influencing people.
But in the past, you'd watch these commercials about Lipitor or whatever, and they would talk about how important diet and exercise are, but you're still going to need your Lipitor to lower your cholesterol. And it's just as the fact that you can do those other things, and that's good and important for you, but you're still going to need your Lipitor.
Or that even lowering cholesterol is the goal.
Well, that's a whole other thing. Yeah.
Well, it is another thing.
Yeah, it's a whole
right.
other thing.
Right.
So
there we go. Yeah, to another place.
Always. I have a deep well of.
Oh my goodness gracious! We will plumb those steps here on the show. Yes. All right. So, Ted, what other personalized? Should we talk about personalized? I hear that used kind of like the word holistic as a marketing term.
Okay.
That now doctors are saying, well, if you come to this practice, your plan will be personalized. And what they mean is, I'll pick the right statin for you.
Right.
to run with that metaphor. And
Yeah.
I think then people don't understand what that word means to a naturopathic doctor. I know what it means in my world. It means I'm going to pick the drug for you.
Right. Yeah. I mean, in our world, it comes right back to what we were already just talking about, that we look at each and every patient as their own unique self, and they have different factors that are contributing to their health issues.
All the factors the aforementioned factors.
Exactly.
You will take time to find those factors.
Right.
Yes.
Right. You can have a patient, 20 different patients, they all come into the office with fatigue, and there can be 20 different reasons why that fatigue is happening. And even on top of that, maybe 20 or 30 or 40 other factors you need to look at to understand how to really help that body to heal so that they can overcome that fatigue.
So on that note, an interesting distinction that's coming to me, because when I hear you both speak, you're very much working with the patient. The patient is an active participant.
Oh, yeah.
Right.
And I like to say to patients, even in the pharmacy, it can't happen without you. But because we kind of have this helplessness programming, how do you overcome the patient who wants to be in the same paradigm? Like, okay, well, this MD gave me these drugs. You're just going to give me supplements and herbs, but I'm still out of it. You tell me what to do. I don't really want to participate because I think they just don't know that they can, or they've never had perhaps the experience of really being an active participant in their own well-being, which sounds like madness, but this is where we are.
Right. Yeah. And
do you have that? Do you have that as a barrier? And you both
Sometimes.
Well, of course.
Yeah.
How do you overcome it?
I ask them where they want to start. And if they don't know, and I say, if I feel like a conversation is not going anywhere, or they're kind of throwing stories and they don't know what, they want to do, I say, like, what's your main goal today? What do you want to feel in a month? How do you want to feel in a month? And they go, I want to feel like this. Okay. It's a great goal to have. How many steps are you willing to take right now? One step? Is there one thing that you feel like you could do every day? It's motivational interviewing.
Love that.
So it's like, what's one thing that you feel like you could do? Okay, if you do that one thing and you feel this way, what are you going to get from it? So you pair up their, basically their expectations and the benefits with the features of what they're doing. So here's some things that you can work on so that you can have this feeling, so that you can benefit in this way. I want to be out of pain so I can run after my grandkids.
Love it.
Okay, great. So here's one thing you got to do. It's the hardest thing, but it's one thing you can do every day. Stop eating sugar. And they're like, oh, really? Just one thing? Yep.
I love
I go,
that.
okay, write it on your hand. You know what I mean? So
lead with the benefits.
Sometimes
Always.
it's just one thing at a time, and then they get the hang of it and realize they do have power.
Right. And
How
that's
about
the
you,
thing
Ted?
is,
How do you overcome it?
well, a lot of what you said, but every patient is different in what they're able to put forth.
Right.
So some patients come in and they're in a place where they just want to go gung-ho and do everything they can to feel as best as they can. In fact, I have a really good story about, I have a patient that I've seen a couple of times, a gentleman in the office, and he's really put forth a lot of effort in his diet and we've gotten him healthy over just a couple of visits. He's feeling much, much better. And yesterday, his wife came in for a new patient visit. And she wasn't anywhere near the same place. In fact, I don't know the whole story with it, but she was at least 15 minutes late. And once she got to the front desk was, well, I know I'm really late, so you can just, if you need to just cancel the visit, that's okay. Because I think that I think the office was trying to get a hold of her to see what was happening. And I think actually talked to the husband, and he made sure she got in, but she was petrified. She saw how everything that he was doing, and she didn't feel like she could do all that. And it was really, she was really scared. And so I had to have a much different presence with her than I did the husband, where we're taking things a lot more simply, trying to calm things down so that she's able to listen and able to understand some of the things we're trying to do. And where with the husband, we focused on lots of diet factors and some different supplements. I told her we're not going to focus on diet. And that was the biggest relief in the world to her.
Oh, you really met her where she was. I feel that.
Right.
You really met her where she was.
Yeah.
That is a beautiful example of personalized.
And it's going to take a lot of time. And it's going to take a lot more time when we're not doing everything together. But it's going to be a lot quicker for her than not doing anything.
Right. Yeah.
That's a really great story. I love that. And that's what you mean when you say personalized.
Right.
What's important to you, just seeing where they are and meeting them where they are.
Yeah.
I think that is absolutely beautiful. And on the note of that, like the word personalized, the word holistic really gets thrown around a lot. So I think if you guys are game, we would spend some time explaining the difference in holistic modalities, especially here in Ohio, because there's a big functional medicine influence, I feel like. So for us personally in Ohio, that's a big one. Like the difference between naturopathic medicine and functional medicine, because the people just don't know. And maybe other types of holistic practitioners, just to help people understand so that they hear it from professionals versus the socials.
And so the big push here is that Dr. Mark Hyman partnered with the Cleveland Clinic. And so
did you know that?
Nope.
So they have a whole big functional medicine program through the Cleveland Clinic.
That's cool.
Yeah, it's cool, and in a lot of ways, on the surface, it looks great, but in practice, it's not anywhere near what you'd expect and want. Because it's so busy.
Sure.
I've heard several patients who go in there, they get thousands of dollars worth of tests done, and it's going to take 6 months for them to get back in to even go over any of the tests. So by that time, all those test results are worthless.
Yeah.
And I guess that's one of those things that I guess in general have a problem with a lot of how functional medicine practices. It's all very much test-based. They order a whole different panels of tests and treat off of those tests because that's how they're trained. But if you run all of those tests all at once, then either A, you have to give them 50 different supplements.
And they do sometimes they do.
Or if they go step by step and treat the first test, the most important one, well, then that's going to change the results in some of these other tests too. So once they get to the next one, it might not be where they're at.
Ted, that's just a lot of straight talk right there.
Well, a person's not a car. You don't just
Right.
plug them in and run a diagnostic and then
Right.
replace
Right.
the water pump.
Plus, what I used to tell the women who would come into me probably with their TSH, here's my TSH. This is why I need this or need that. I'm like, we don't treat pieces of paper. We treat people.
Right.
Isn't it the same thing?
Definitely.
But it really feels like it feels personalized and it feels high tech.
Because it's
Right.
different.
Oh,
It's different than what they're used to.
very
Like, oh,
interesting.
this is fancy.
So,
Right.
Yeah.
But here, I pulled up definition of functional medicine from the Institute of Functional Medicine, which is really probably the top organization that will train different practitioners.
Great. Let's have it.
And so their definition is, as a catalyst in the transformation of healthcare, functional medicine takes a comprehensive whole health approach to prevention, health, and well-being, treats the root cause of disease, and restores healthy function through a personalized patient experience, all while being a vital partner to conventional medicine.
That sounds like you.
Doesn't that sound like exactly what we were talking about?
That is exactly what it sounds like. If I was a patient and I read this and then I read like your website or a definition of naturopathic medicine, I would have no idea. I'd be so confused.
But what it comes down to is it's because functional medicine really came out of naturopathic medicine. Yeah. Most of the doctors that taught these doctors and run the courses are naturopathic doctors.
I had no idea.
Yeah. Yeah. So, but functional medicine in general, you have MDs, DOs, chiropractors, nurses.
Oh, a chiropractor can be a functional medicine practitioner?
Yeah.
They often are.
Yeah.
Oh.
Yeah. And you'll even have health coaches that go through some of the training, but they're not certified and still call themselves a functional medicine practitioner.
I saw that on Instagram. I was going to announce to you guys that I'm going to take a 20 to 30 hour course in nutritional medicine, and I'm putting up a shingle.
I'm
Wonderful.
surprised that's not a protected term.
I will be your first patient. Well, it's just like naturopathic medicine.
Yeah.
If each state, I don't believe there's any state license anywhere.
Right.
So so you can't restrict that.
Yeah.
That's a really good point. When I saw the ad, it was so pretty. She looked really happy.
Right,
This after her 20 to 30 hours. Now, I don't know what it cost her to become this so-called whatever it was. I don't even remember, but I'm like, wow.
Yeah.
Beautiful, spunky balayage hair.
Yes, but trained by functional medicine doctors, some of which are very famous, some of which whose name we may or may not have mentioned today.
Exactly.
Okay, then.
But the typical training, because you have to understand these doctors, there are other types of healthcare practitioners that don't get natural medicine in their training of medical school or whatever. That's fair. So they're doing some weekend courses and seminars. So I actually have that IFN. Was it IFN?
Yeah, it's IFN. Yeah, I think so.
They're what they have to do to be certified, and there's 6 different courses. So each of these courses are 15 to 20 hour courses. One in GI function and dysfunction, one in environmental health, one on the immune system, one on hormones, one on cardiometabolic, so of course that will pull in heart disease and diabetes and things on that end. And then bioenergetics, which they've defined as examines mitochondrial function and its relationship to oxidative stress, nutrition, lifestyle, highlights their roles in health and disease. So it's sort of like a cheat sheet to understand how to treat some health issues on a big level without having to go through a whole medical training in natural medicine. So, and a lot of people can do really well with that and can be great practitioners and really understand the body and really get into it and sometimes be more effective than a naturopathic doctor. I'm not going to say that functional medicine isn't good.
Right. These are all tools.
Oh, yeah. You're just defining just for the people, the difference.
Right.
But just the fact that there are differences in the training, and functional medicine, especially in places like Ohio, I've heard plenty of times where people are like, well, I think I need to see a functional medicine doctor for a better outcome.
Oh, yes.
Because that functional medicine doctor is going to be more educated than me.
Yes.
And
that's
hasn't
the perception.
happened often, but I've heard that a couple of times.
Well, there is a perception like that.
Right.
There's a status, and they've done a great job marketing that.
Right.
Yeah.
And I guess part of that lends to how I approach my patients too, because I'm not worried about the title. I'm not worried about making myself look like the smartest person in the room. My goal is always to do what I need to do to help the patient, which means that I typically don't use medical terms. I try to be on their level and help them to understand how we can work together to help them to heal.
Right.
So some people can take that, especially since I'm not licensed in the state, that I'm not quite the same level.
Yeah, not the same status.
Right.
You're a witch.
But that brings us to talking about, since naturopathic doctors aren't licensed in states like Ohio, we're recognized in about 23 states right now and a couple of other provinces. But because we don't have a protected title in, say, Ohio, there are people with little to no formal training that can call themselves naturopaths or naturopathic doctors.
That's a problem in
Yeah.
Ohio.
In fact, just a couple of examples of people in this area. One person on her website, she calls herself a board-certified naturopathic doctor.
How can she
And-
do that legally?
Well, because there's no protected status here in Ohio.
Oh, that's right. Board certified by what board?
But it's a made-up board that pays some money, and they can call themselves board-certified by this board.
Oh, dear. That's so confusing for the public.
And so you go through their website, and any well-trained naturopathic doctor is going to list where they went to school.
Right.
Good
and
point.
things on that end. If they're in a state like Ohio, they're going to list where they're licensed.
Yes.
Because we all carry a license in another state that does license naturopathic
You do too?
medicine. Yes.
Oh, I didn't know that.
Oh, yeah. Yeah. I'm licensed in Vermont.
I've known you for how long? How did I not know this?
And being licensed in Vermont was really, for me, it came down to, well, for one, it was 23 years ago when I got my license, but there weren't really much of it. There really wasn't any state closer to Ohio. Since then, Maryland and DC are licensed, which would be a lot closer.
Yeah.
But Vermont was really the closest place to Ohio, and
Wow.
they had a good scope of practice, and it was easy for me to get my license there and keep it, so that once naturopathic doctors are licensed here in Ohio,
You have
I can
reciprocity?
transfer
Oh,
my license.
very nice.
Versus if I weren't to do
Oh.
that, and then once Ohio licenses naturopathic doctors, I would have to then retake board exams and do all these other steps so that I could get a brand new license.
Right.
So speaking of which, should we talk about your education then? Since we've kind of talked about the education of a functional medicine doctor, and
I want to give just a couple of little more things about these unlicensable naturopaths. So that same person that I said calls herself a board-certified naturopathic doctor. You go to her website, and the only training she has listed is that, well, she shadowed a heart surgeon for a period of time. She also had some point in time worked with some kind of cancer specialist and some kind of nutritional biochemist. So no actual
medical
formalized
degree.
training in any
No
way,
degree.
shape, or form. Right.
oh, that's interesting.
Other
no
people-
pre-med, no
Exactly.
no grad school, no clinical rotation rounds.
Wow, and your average Ohioan perhaps wouldn't know that is not sufficient.
Right.
Right.
And there are online courses.
Oh yes.
One of the most common is called Trinity College of Natural
Is that
Health.
still out there?
Yes. I went to their website just this week, and their naturopathic medicine course, it looks like you probably can complete it in 16 weeks, and it's $2,000. Although if you pay up front, you get a 10% discount.
I'm going to do that too. And that's so funny that they're still around. I used to teach alternative medicine to pharmacy students.
Yeah.
And that was always the test question. Which one of these is not an actual school for naturopathic doctors? And I'm like, one day this is just going to be not going to be able to be a question because that's not going to be in existence anymore.
Right.
And here we are.
Yeah. And I mean,
still in existence.
now we have legitimate distance learning colleges.
Yeah.
True.
Where, say when I graduated from medical school, you really didn't have much of that. But so you do now have colleges that are certified through the Department of Education that have different courses that you can graduate, not naturopathic medicine, but say you want to be an MBA or an accountant or a nurse practitioner even. You can do an online course to get certified through a legitimate school.
They have the technology in place for accountability and for
there
them
you
to
go.
remain accredited.
Accountability.
But these
Accreditation.
schools don't have accreditation under any legitimate board under the Department of Education.
There's no oversight.
Right.
There's no accountability.
Right. And if you every one of these schools that I've looked at, and you look at the requirements,
Did you wake up this morning?
Every single one of
do you have a
them
pulse?
has a clause that says, we understand that life experience matters. And it makes it sound like, well, you could take their course and graduate from it and call yourself a naturopathic doctor, even if you don't have a high school diploma.
Because you have life experience.
Exactly. That's
And
more important.
you're gonna be in charge of people's health and well-being.
Holding back so much right now.
Oh my. That's reality though.
Right.
That's a truth bomb right there.
Yeah.
So do you want to talk about your education then?
Sure.
Because I
Yeah.
think people don't understand
Right.
that you went to medical school.
Right.
My personal education took a really winding path.
Yeah.
Would you like to hear about it?
Let's hear it.
So my whole life, I've been an artist, and like painter, sculpting, like candy making, doing lots of things like that. I went to film school. Actually, I have a film degree. I had no inclination of ever becoming a doctor. Although when I was a child, I had a calling on my life that it kind of was like, no, I'm not going to be a doctor. Like I remember legit saying those words when I was like 5.
Wow.
Isn't that weird?
As a response to an inner calling. The way you
Yes.
said it's like, that's amazing.
Right. So that was there from a very young age, and I've always helped others.
Mm-hmm.
When I finished my film degree and I worked in Hollywood, and I was like, wow, this is terrible.
Oh, wow.
I started working for Apple, and then I was like helping a lot of people in the Genius Bar doing like tech support stuff.
Mhm.
And people would just pour their lives out to me. And I remember one day, it happened at least one time. So there was one or maybe even 2 times, it was a while ago now, where someone would come back and say, hey, I don't really remember your name, but I remember talking to you last week and I was ready to take my own life. And then you changed that.
Wow.
And I was like, what?
Right.
Like, how do I have this impact on people?
Yeah.
And then eventually I was like having my own health struggles and dealing with stuff. I figured out my own Hashimoto's thyroiditis on my own. I fired my doctor and I was like, I'm on a mission now. I'm going to help every single person. I don't know how. Seems like nutrition's the way. So I went back to school. I got a bachelor's in nutrition. And then after that, I was talking to a naturopath in California, where we do have licensing. And so I was working with an integrated MD. She's so cool. Her name's Kelly McCann, just an awesome lady. And then she had a naturopath there. And I was like, I want to know about that. Like, that sounds really cool. And they kind of like mentored me in that area, and like, you know, maybe you want to do MD school, maybe you want to do this, maybe that. I was like, no, ND seems right. I went to Southwest College of Naturopathic Medicine, which is now today known as Sonoran, which whatever. But I went there and I was like, I feel at home here. I met all these people. I made jokes about levitating hippies. I saw all their research stuff in herbal medicine. I was like, dude, this is so cool. They're marrying research and Western like diagnostic, therapeutic, like level, like high level diligence and scientific rigor with natural, like Eastern, like all these different ways to deal with things, and nutrition. I was like, this is so cool. So I went there and I finished all of that. That was 4 years of school, including clinical rotations. I did lots of outside stuff. I actually did my residency. It was cut short, but I did a partial residency in interventional orthopedics. So I did a lot of like joint injection types of things. And I got into doing that, and like some ultrasound diagnostics. And then eventually I came back to my first love. Remember how I said I figured out my own Hashimoto's, which is an endocrine disorder. And I've just been obsessed with endocrine ever since, because during the kind of COVID times and all of that, a lot of stuff, you know, got knocked out of my lap, and then other things arrived for me. And then the more patients I saw with all of these metabolic endocrine problems, and I have so many diabetic and like hormone imbalanced people. But yeah, so that in itself became part of my education. And so anyways, I'm still working toward even further education with the endocrinology board. so that I can take everything that I use to try and help more of those type of patients. So, but yeah, so that's the kind of the meandering path that my education took.
Right. Yeah. So to recap, you did have to do a bachelor's degree. And
That is required for your education.
Exactly. It
Just
is
like
required.
like a traditional medical school, you
Yes.
need a bachelor's degree to get in.
Yes.
A naturopathic medical school, you need a bachelor's degree to get in.
Yeah, and including all of the same type of basic science courses. You need your biology and chemistry and biochemistry and whatnot so that you can be accepted. Now, naturopathic medical school, we don't have like the MCAT,
Right.
because we're not the dominant form of medicine in this country. So there is not such a huge competitive nature to that.
Ah, okay.
I mean, conventional medicine, I don't know what the statistic is, but obviously there are lots of people that apply that never get in.
Right.
But that's neither here nor there. But so we have to get a 4-year undergrad degree, and then it is a 4-year medical school.
And where did you go to school, Ted?
I went to the same school, the Southwest College of Naturopathic Medicine.
Wow.
Sonoran University now. Yes.
Yeah.
And so with that, we do our first 2 years of schooling are very similar to an MD program. We do all of your regular anatomy and physiology, your biochemistry, all of those different courses. In fact, my younger brother, who is a primary care DO, he started osteopathic medical school actually a couple of weeks after I graduated from medical school. And so I was able to pass on a lot of my basic science textbooks because they were still the same textbooks that he needed to use.
So nice.
And so those first 2 years have a lot more to do with that basic science. And then the third and fourth year are a lot more with the clinical. So we still have to learn pharmacology and conventional diagnostics, but we do a lot of training in different natural therapies. So we learn about nutrition and herbal medicine and homeopathy and physical medicine and all of these different natural therapeutics.
Traditional Chinese medicine too.
Exactly. At our school.
Yeah, at our
I
school.
don't believe any of the other schools have that.
That's something I liked about
Very
our school, 'cause
interesting.
In the state of Arizona, a naturopathic doctor who passes the Chinese medicine boards, you can practice acupuncture and Chinese medicine.
Right. So they have to give education in Chinese medicine and acupuncture.
Interesting.
So that these people can practice and be safe.
Yep.
That's very interesting.
Yeah.
So is there anything else you wanted to say about your education? I'd like to just touch on the therapies that you use. Since you mentioned you're trained in so many therapies, I'm sitting here wondering, how would a naturopathic doctor, I'd like to know which really resonated, which you brought from school into practice.
Right. Yeah. And so that's one of those interesting things where we do pull a lot of different therapeutics based on.
And you can't do everything.
No, you don't want to do everything.
Okay.
And everybody has certain therapies that they're better at and certain things that they're exposed to. And you see that works. So that leads you to keep doing more research and learning on that therapy.
Or like you said, your patient population, who are you attracting?
Yeah.
Right?
Yes.
Yeah. What kind of people?
Yeah. Yeah. So, so for me, I tend to focus on nutrition, not just diet, but also dietary supplements. So our vitamins, our minerals, and our other dietary supplements. And of course, that term dietary supplement, we have another episode.
We covered that.
If you want to learn exactly what all of that means, you can look at that. And so that's a lot of my practice. So to talk about some of the different things that I've seen with that, just with diet-based therapies. So really cool sort of case that I saw. A patient came in and she was having daily debilitating migraines. She was, I think, 28. She had 2 young kids. They were like 4 and 5. And when her husband left for work, she's on the couch and her kids are taking care of her. So it was just very debilitating. And so she came into the office. And so the main therapy that we did was work on diet and eliminating some food sensitivities. And for her, the two things that we really focused on were wheat and dairy products.
Mm-hmm.
And within a month, her migraines were gone. So where she was living with daily migraines for several years, within a month of giving up, actually, we found out it was wheat, her migraines were gone. And she only would get a migraine after that if she had some wheat. And of course, as you're starting to make dietary changes, you don't always understand that. And you always should challenge that.
Mm-hmm.
You don't just go and eliminate all these foods forever and not add some
People
back
do
in.
that, though. I think
I
they get a
know.
little extreme with that.
They do. And my philosophy with this, and of course, we've talked before about how I work a lot with the blood type diet. And I use that as sort of a framework of understanding the foods somebody's most likely to have a sensitivity to. We'll get rid of some of these foods strictly for a month or so. That gives the immune system and digestive tract time to calm down. And when you add that food back in, you see much more of a cause and effect reaction to see which foods really cause trouble and which foods your body doesn't react to so much. Because my goal with patients is always to have as varied a diet as possible.
Sure.
Because that's what's going to ensure long-term compliance.
Mm-hmm.
Yeah.
Yeah.
How about you, Dr. O'Connell? What is your I mean, I'm sure all of you do nutrition, diet, lifestyle, but what else do you?
I'm a keto nerd. So
Tell us about that.
Well,
that seems to be all the cool kids are doing that.
Well, I've been doing it for 24 years.
Oh, maybe you were like at
I
the
am-
very
I
beginning.
am
That
at
was
the-
way ahead of the curve.
Yeah,
I'm at the beginning in terms of trying it out. I lost well over 100 pounds in 9 months doing that. That was part of my health journey.
I was just going to say that seems personal because it would be
is.
linked to the Hashimoto's, which would be linked to a metabolic syndrome. That would all be connected.
Yes. So that's kind of where I started with nutrition.
Wow.
Just kind of on a whim. I was like, well, I feel like garbage and I like bacon. So can't be much worse than this.
We need to have that. We need to have that clip. I feel like garbage, but I like bacon.
Yeah.
This is how we piece things together, people. Right. I love
right.
that so much.
But yeah, so and over the years, because I'm constantly learning about that specific diet, there's many different ways to do a ketogenic diet. There's not just one size fits all.
I didn't know that.
Oh yeah, there's like a very strict version, and then there's a modified version, and that has like blueberries and like different fruits.
That'd
and things.
be the one that I would go for. I
Well,
think
so-
the strict
and-
version makes me lose my mind. I tried it. I got goofy, but I wasn't under a supervision of a naturopath
right.
either.
So that is
Right.
the key, I think, with any kind of diet therapy is that you should work with somebody who knows what they're doing and
Right.
knows the signs to move you in the right direction.
Yeah, that was my
and
mistake.
that you listen to your body because
Right.
your body gives you cues for a reason.
yeah. But if you don't know, like if you don't
Right.
know, I'd never done it. So
But
my
working-
body was probably giving me cues,
Sure,
but
sure.
I wasn't working with
that's what
anybody
I mean.
to help me interpret those cues.
Right. That's what I mean. Yeah.
Yeah.
So working with somebody who can say, okay, these are some things that you're going to look out for.
Mm.
I make a lot of handouts. So I have a really pretty handout that I give to my patients, and we can figure out macros and things. And there's a food pyramid, and the bottom of it is full of green leafy vegetables, and then it's got all these different types.
That
of
is not the official pyramid, madam.
It's my pyramid.
All
Well,
right.
the pyramid
darn
has
it.
been removed, and now it's just a
That was the gospel.
It's my plate now.
yeah, it's just a little plate.
Yeah.
Yeah, carved up like a pie.
It's got
I-
milk in the corner.
I didn't even know that.
Yeah. It's
Yeah.
it's funny.
Gosh.
You know.
Okay.
I mean, it helps some people too. The
Right.
My plate thing helps
Right.
some people who are just eating
Sure.
crazy.
Sure.
Yeah.
The right tool for the job though, right?
Yes.
Yep.
So my go-to is always nutrition, mainly because that's the thing messed up in most human beings.
Most Americans, I
Well,
think.
right. Yeah. So
And one of the biggest things that we have control over.
exactly. It's
Great
hugely
point.
hugely controllable.
Great point. Yeah.
For the most part, some people still struggle with that too.
Well, of
which
course.
is understandable.
Mm-hmm.
But yeah, some other things I can give you examples for though.
Yeah.
I have a great story about a patient who I had. He was in his 50s and he was very athletic all his whole life. He was in high-level collegiate football. He liked to play tennis with his son. Very athletic man. He hurt his knee, and then for years he wasn't playing tennis because he couldn't pivot anymore because it hurt so much. And I was like, okay, like your diet is good, like you're healthy, you exercise, you take care of yourself, you sleep well, your stress is low, like what can we kind of affect? Well, there's this thing that we can do in Oregon called prolotherapy, where we inject sugar water basically and a little bit of anesthetic into the space of the tendons. We can poke it with a needle. And so the prolo part of prolotherapy is proliferate. And it means to basically help trigger a healing response, that vis, the vis medicatrix naturae, the healing power of nature, one of our principles. And so by injecting the sugar water, this irritant, and then numbing it up, it resets the nerve signal, and then it feeds the tissue while it irritates it and brings healing to that area that normally doesn't have a great blood supply in the knee.
Yeah.
I did an injection into the knee and then around the tendon, and he has not needed another one since, and he's been playing tennis on it for a few years now. That's no problem.
That's wonderful.
That's amazing.
Yeah.
But can you do that in Ohio?
Sadly, no.
Yeah, I didn't think so.
Hopefully one day we'll get all the full oversight of like full licensing of the state, and the hope, because the scope also depends on the state.
Right.
Not all states allow naturopathic doctors to do injections.
I didn't know
even
that.
Even if they are licensed.
So, right.
Oh.
Yeah, so the scope is different based on each state. And we just found out 2 days ago that Pennsylvania now has a new registration law. So it's not a full licensure. Still waiting to find out what that means, but
good old Pennsylvania.
They're definitely a lot farther ahead than we are here in Ohio.
Wow, look at that.
And they're only a couple miles over that way.
That's right.
I believe in Vermont that you can do injections in Vermont as a licensed naturopathic doctor.
And since you're licensed in Vermont,
no problem.
You can get on a plane, and your patient can get on a plane for a hefty fee.
Right.
And you fly over there. You still need a place to do it and all the equipment.
To be fair, though, you do need to be really well trained in injections.
I would think
they're
so.
not easy to just pick up and
I would
do.
think so.
Yeah.
It's such a great point to think.
Nobody wants to pay me to give them injections. Trust me.
At this point, until you've been trained. But I think you guys have such a great respect for just training.
Oh yeah.
And I get irritated when like an MD says, "Oh, I went to a weekend seminar and now I'm an acupuncturist." I'm like,
"Oh, cool."
Maybe you are on paper, but I don't know that I would go to you for
here in
acupuncture.
Ohio, they don't even need to go to those seminars anymore.
They can just call themselves an acupuncturist.
Well, they can't call themselves an acupuncturist, but they can do acupuncture.
Ugh.
Oh,
MDs, DOs, physical therapists, and chiropractors don't need any education at this point.
And to me, that's kind of like a very watered down form of acupuncture. It's like this. It's like when I was in my car accident, the MD I went to, before I even knew what was happening, no, he did not have consent. He went, boop, boop, put an acupuncture needle. Okay, so I don't know that we can call that acupuncture any more than if he would have given me arnica. Could we call him a homeopath?
Sure.
Right.
That's how I liken it. Like,
Okay.
right? Just because you use the tool doesn't make you the one that really knows about it.
Yeah.
Right.
Okay, we all agree on that. It's fair.
Oh yeah. And on the note of acupuncture and Chinese medicine, I've also seen where not in Oregon, because naturopaths in Oregon have to be actually licensed acupuncturists to use acupuncture in Oregon.
Okay.
But in Arizona, I have seen where someone who had something called Saturday night palsy, where you sleep with your arm over your head and then your arm goes numb and you can't necessarily move it very well. She actually had it stick for weeks.
Oh my.
She couldn't move her fingers. We did electroacupuncture and she got full use of her arm back in like a couple treatments.
That's very cool.
It's amazing.
Yeah, acupuncture is awesome. Our acupuncturist in our office is
Yeah.
amazing.
He's very good at what he does. I
including
always
like
steer
I've,
people.
I've seen case studies with him, actually helping bunions to heal.
That's
And-
supposed to be impossible.
right. No, but the joint straightens out and the foot's. Yeah,
Does he tell him to wear wide toe box shoes also?
I'm not sure how he does that.
I should ask him.
We'll
Yeah.
bring him on the show one of
Yeah,
these days
there
for
you
go.
sure.
You're like, Tim, what do you think of wide toe box shoes?
Yes, I have many questions for Tim Iliff. So what other therapies do you either one of you like to use and why? As part of your training, your repertoire, you think really helps people, you have a good story about?
Yeah, so in that clinical nutrition, like we talked about vitamins and supplements, and so that's most naturopathic doctors, we use a variety of those different nutrients because we're giving the body extra nutrients for it to heal itself. And so one of the supplements that I use a lot with patients, because we have a lot of mental health issues in our area, 5-HTP, 5-hydroxytryptophan, which is a precursor to the brain chemical serotonin. And so by giving 5-HTP, it helps the body to make its own serotonin, which can have lots of different benefits. I mean, so it can be used to help people, like we talked about earlier, with the patient that's on the antidepressant.
Yeah.
Obviously, we don't want to give them together because the antidepressant drug blocks serotonin from being eliminated. The 5-HTP helps you make more, but
serotonin syndrome, perhaps.
Right.
Yes.
But anyhow, so, lots of patients that their anxiety and depression symptoms are calmed down. Several patients with debilitating hot flashes that are gone overnight.
Interesting.
Because with these menopausal symptoms, one of the factors is that those hormonal imbalances, which not just menopausal, but premenstrual too, those hormonal imbalances reduces your body's sensitivity to serotonin. So it's not that you might not necessarily be not producing enough serotonin, but your body needs more to have the same effect. And so by giving that extra, helping the body to make more serotonin, it can help to calm down that hot flash, also help them sleep better and be in moods much better. And so it's something that can be really great for patients.
Yeah, that's a great example of using a pretty simple substance.
Right.
Any other modalities that you like to speak on?
Well, I actually just wanted to, so what he's talking about too with increasing, especially for hot flashes and everything, the serotonin, it's interesting from my point of view, working with a lot of female hormone imbalance patients, is that it's for women who are still menstruating and having a cycle and want to keep having a cycle. They're not like toward the end there with, perimenopause or postmenopause. The only time that a woman's body makes progesterone is when we ovulate. And so that progesterone is also upstream from 5-HTP. So helping women to ovulate, which a lot of women don't know that when they take oral birth control pills, for example, you don't ovulate.
That is something that really should come with every pack.
Yeah.
So you don't ovulate, you don't make progesterone, you don't make 5-HTP, so you don't make serotonin.
And this can start when they're 12 or 13.
That's
for
right.
acne or whatever.
Right, because the key with working with very young blossoming women that are just starting to have periods is that the first periods are going to be hard because you're not ovulating yet. So your estrogen's all over the place. And then, you have to wait for that progesterone to come. So sometimes if you add some like certain nutrients, even seed cycling can be really helpful because seeds have actually quite a lot of like hormonal action. And or you can do, there's like a bunch of different things you can do with nutritional supplements that will help young women while they're on their way to getting their regular period with a regular ovulation so they get regular progesterone and they feel better and they're not like, oh, I'm anxious and I feel like I'm going to explode and die and I don't know why. But the doctor said take birth control pills.
That's what they
or
say
even
quite
some of the
often.
more well-meaning ones will prescribe progesterone, but they won't tell them that in order to work with your cycle, you need to only take it 2 weeks out of the month.
That's right. Yes. Yeah. Cycling.
Yeah, I used to work with the bioidentical hormones and fixed a lot of prescriptions. It's confusing.
It is. Right. It is. Even for me, when I first started working with bioidentical hormone replacement therapy, which I can't do exactly in Ohio, but I do something like it using nutrition and supplements.
Oh, nice.
There's a lot of different things you can do, but when you first start out, it's a whole other world of information that is really important to understand every aspect of, because there's so many pathways.
Right.
But yeah, being able to be the one who knows about that for the patient's sake makes them feel more at ease. And, you can give them that confidence that they're going to get their periods back, or they're going to be able to have babies, or, or that they're not going to have to suffer through perimenopause, or that, there's a reason that they feel like this. They're not going crazy.
Right.
I love that. It's a great
Or
example.
even for the patients that have a family history of breast cancers and things, to be able to reduce their risk factors there.
Yes. And there's
Great
a lot
point.
of women who have come to me and they say, I'm having a bad time with perimenopause, but I have cancer in my family. What do I do? And it's like, well, there's definitely answers for you. And it's not what it was in the 80s. I'll tell you that.
No.
All right. So there are 6 principles of naturopathic medicine, and we covered most of them, but we want to go in a little bit deeper on the one. So the 6 principles are the healing power of nature, identify and treat causes, doctor as teacher, treat the whole person, prevention, and first do no harm. I definitely want to touch on first do no harm.
Yes.
But before that, let's talk about the healing power. What would suppression? I want to talk about suppression because I'd love to talk about it.
Right. So that really...
Because most drugs
Yeah.
either stimulate or suppress,
Right.
which is a whole different energy. Giving a medication, you're going to stimulate or suppress. You're not going to get underneath or treat.
But regardless of whether it's stimulating or suppressing, it's still suppressing because it's just getting rid of the symptom. And that would be what I would call suppression.
Very good.
Giving a
That's
Band-Aid
fair.
to get rid of the symptom.
That's fair.
Not actually healing the body.
That's fair. I do a lot of that. I give in bottles and really pretty pills, like suppressive
Right.
chemistry.
Pharmacology versus... There's another word that I can't think of. But even herbs have pharmacologic action versus supportive or tonic or nutritive action.
That's a great point. Yes, they do. Because herbs can act like the first drugs were herbs.
Right.
Yes.
Definitely.
But they weren't just doing one thing, though.
Because we don't know all the constituents or
There
the
we go.
energetics that are part of each plant, which is a living thing.
Which is so different than finding the plant, what we tend to do, which I think is a bit aggressive and short-sighted.
Reductionism.
Yes. Oh, well, let's go find the active ingredient.
Right.
When maybe, yes, there is an active ingredient and we can take it out and test it, go
And make
through all of
money
that.
off of it with a
Sure, we
patent.
can. But perhaps we've thrown away pieces that were supportive, prevented a side effect. We don't know.
Definitely.
We don't know. So suppression. The naturopathic physician does not suppress a symptom.
No. We talked about that earlier. We can. And sometimes it happens, but
Okay, what about the fever? This is what having a naturally naturopathic mindset, even though I went to pharmacy school and practiced as a pharmacist, I always believed and then found practitioners that supported it, that the fever is your friend.
Right.
Okay, so in the traditional system, I think people believe that a fever is a disease.
Right.
That must be stopped and treated. It's not a disease. It is a symptom by and large. Unless, right?
Well, but it's part of your body's healing process.
Yes.
It's about heating up the body higher than that virus can handle, so that virus cannot live. And that fever might not do the full job, but that's the point of the fever.
And we learned that with AIDS research. We didn't know that before AIDS research. And I was a little baby pharmacist in the 80s, and we were just learning about HIV. And we learned that when I was working at Metro Health Medical Center. Someone came in and taught us this. And I remember sitting there going, well, if we know that the fever is our friend, then we can expect a really dramatic decrease in the sales of acetaminophen, which did not happen. But there again is the difference between what we know scientifically and maybe like a kind of a money driving force.
Well, and I think what it comes down to is the fear of that fever causing a seizure.
Okay, can we please address that?
Yes. So the likelihood of a fever causing seizures or other febrile diseases isn't typically based on how high the fever goes. You could have 105-degree fever and not have any undue problems. The problem and tends to happen when the fever rises too quickly. And so that that very quick rise in the temperature is what
could
typically
potentially
causes
cause that.
problems.
And what about if the fever goes up and down and up and down with cyclical medication? Can that cause a seizure? Like it's high, so you give a medication, then it comes back down low, and then it wears off well before you're allowed to, or whatever. Maybe it breaks through. Could that also cause a seizure?
I don't know.
Okay. Well, I just think that this is something that I hear all the time, that everyone is so afraid of febrile seizures.
Right.
Yeah. And always do what your doctor says. I guess we should always say that.
Exactly.
Do whatever your doctor says. But we're just talking about just things we know from research, that a fever is a signaler that's and a helper of the immune system.
Correct.
Yeah. Okay. What other kind of examples can you give where suppression? We typically in the allopathic system suppress, and you would see a problem with. I know it's any symptom, but what's another big one?
I mean, that's really probably the number one that is getting into the way of the healing process.
And I think of the example too, like sometimes when my kids would be throwing up, so that they wouldn't be fearful of vomiting or think it's such a strange thing, I would say, do you want the bad stuff in or out? Like your body's trying to get rid of something. Obviously, there'd be a time where it could be pathological and you need to intervene with a medication. But sometimes I wonder if we're stopping something that the body just naturally knows, hey, something is wrong. I got to get rid of it. And then we don't want to necessarily keep it in.
In the same token, cough suppressants.
Oh, that's a good example.
Very bad for asthmatics.
Right. So you don't want to cough, but the coughing is trying to eliminate mucus.
Yeah.
That's a great example.
So if you suppress the cough too much, that mucus is going to stay in the lungs more.
Which really bothers me, because most of the over-the-counter medications have an expectorant and a suppressant.
Right.
Is the cough coming up or down?
Right.
Like a lot of times we just want to thin it out, and then they put this other stuff on top of it. And the people, to your earlier point, are shopping the front of the box, which is the benefits, and not the back of the box, which is the features and the chemistry, and don't understand you don't need two things for this cough, that you perhaps need to just thin it out, thin out the cough to help the body eliminate it.
Right.
Anything else on suppression?
Yeah, actually, a more complex sort of example with regard to type 2 diabetes, for example, is so when someone has type 2 diabetes, they have their blood sugar's too high. So typically and their pancreas is still working, they're making insulin, maybe they're resistant to that insulin, and that's why their blood sugar keeps going up, which then
meaning the insulin can't get into the cell, so it hangs out in the blood.
Yeah, so your blood sugar goes too high, then you have like neuropathy and all these different things happening, because the blood doesn't like to be syrup, it wants to be blood.
Of course.
So with allopathic medicine, usually they're giving glucose lowering drugs.
Example would be insulin or glipizide.
Right. So you can have ones that make you flush out more.
Okay. The second
urine,
generation ones. Yes.
Right. And then you can have ones that are increasing insulin, which just further pushes the problem along. But none of those things are addressing kind of the root of that. They're suppressing symptoms and making it so that their blood glucose is a normal level, but the imbalance is still present. So they still have long-term disease outcomes, eye disease, neuropathy.
Because it's not just about the glucose being high, but also the insulin being high.
So they're treating a lab value, and they go, well, and on top of that, the lab value for diabetics, which is considered
normal,
good, is 6.5 or less, rather than
that's the A1C.
That's the A1C. Yeah, so 6.5% A1C. That's the blood sugar over 3 months, just to clarify for anyone listening. So it's a really good measure to see how someone is doing, but it doesn't tell you the peaks and valleys of that person's blood glucose. So you don't know if they're crashing out or if they're going half blind because their blood sugar's so high. And then you also don't know, like, you're not addressing necessarily what they're eating which if you can keep a tighter control over blood glucose, you have more longevity just by default, because too much insulin and too much blood sugar both are huge risk factors for heart disease. So basically, an endocrinologist who's working with a diabetic and just doing the regular like medications, high carb diet, by the way, the American Diabetes Association diet is a 65% calories from carbs diet.
It sounds like madness to me.
It is, but it's for type 1 and type 2. So you're talking about people having really high insulin all the time to deal with the carbs, and and they're like, well, I have to eat this, and then they eat 6 times a day, which also keeps your insulin high, so you become more resistant to it. So you can see that this suppression of the A1C is not addressing anything at all. In fact, it's taking them way into, you're talking about end stage, kidney failure, heart failure, limb issues, amputations, blindness.
But first, do no harm.
Right.
I mean, isn't the medical doctors, don't they also say first do no harm?
Well, they don't have to say the Hippocratic Oath anymore.
Really?
No. Yeah.
What?
It's been several years since that.
Which that deals with not doing harm, correct?
Right.
Who decided that?
I don't remember when that was. But
I think it was
I demand to know.
I think it was the pharmaceutical. I think it was the pharmaceutical industry.
Right.
But that is so interesting, because to me, what you just spelled out was a great, a little bit complicated example of the problem with suppression as opposed to treating underlying metabolic issues, but also down the road, the harm that is going to be done to that patient, which of course brings me back to, you still have the principle of do no harm.
Correct.
Thank goodness.
Yeah, it's so important to, when you're looking at a patient's health and how to move them in the right direction, you don't always have to go with the big guns. Sometimes you can work with the most, like we talked about, both of us do a lot with nutrition and eating properly and, exercising. All these things are very minimal harm and can be very powerful in helping the body to heal. And so, to just jump to medications that might have side effects and cause problems when you can do things that just support your lifestyle to help your body to heal on its own, that's always going to be the best route.
Right.
Yes. Oh, my goodness.
So also going off of that, those therapies, nutrition, exercise, water, sleep, spirituality, all those things, not only low risk and high reward, they give patients agency and ownership.
Right.
And that's the biggest thing for me in my practice, is reminding patients you came here because you want to take control back over your health, and your autonomy matters to me. Your decision-making matters to me. Your brain matters to me. Like your agency and your empowerment matters to me.
Plus it's about, you correct the problem. Well, you need to be doing all these things so that problem doesn't come back.
That's right.
And that's one of those things that a lot of patients don't understand too, is when you're talking about remission versus cure. Most diseases can't be cured, especially chronic diseases. Say if you have diabetes, you can reverse it and your blood sugars can be perfect, but you can't necessarily cure that, because once you go back to your old bad habits, it's going to come back.
Right.
So you've never, so you can, an infection can be cured. There's certain things like that can be cured. And sometimes with surgery, you can cure a cancer or different things. But for most chronic diseases, it is about taking ownership of your health in order to, own and take care of yourself and maintain long-term.
Right.
And I like to tell my patients that the more they work on those lifestyle factors, the less supplements they need to take.
That's right.
Sure.
Yep.
And another thing we didn't really cover much was the principle of doctor as teacher. And that's so important.
And I
for
feel like
naturopathic
I think we got that though. Like I really feel like just listening to you.
Right.
And I'm, your patient. Like you're teaching me things
Right.
that empower me. And now, I understand.
Yeah.
So I can connect the dots for myself. It is very empowering to understand.
Right.
And to have someone in your corner. And the word doctor means teacher.
Yes.
And I think in the traditional system, they've gotten so far away. In fact, we don't say doctor,
Physician.
we say prescriber.
Ooh,
Yeah.
We don't even
really?
say physician. We say, who is your prescriber? Isn't that
Weird.
amazing?
Well,
Yeah, I never
because,
thought about
Because
a lot
it-
of times you might have a nurse practitioner or
Right,
a
right,
physician's
right.
assistant.
But the bottom line is, who's giving you drugs,
Right.
medications? Who's prescribing? It's very interesting.
Yeah.
We've gotten away from that word for a good reason, because there is
Yeah.
more time spent prescribing than there is teaching.
Right. And as a naturopathic doctor, if we're doing our job right and getting our patients better, we're teaching people how to not need us so
Yeah.
much
Yes.
so that they can take care of themselves
Amen.
and come back if something else happens and they just need to get back on track. But we're giving them the tools to help understand how they can keep their bodies healthy.
Yes, I love that. In fact, I think I've hired you for a couple things, but the blood type diet didn't really want to spend the time or the energy. So I hired you so I could come in and you were going to give me the lowdown on the blood type diet. And that's what I wanted. I didn't want to wade through all of it.
Right.
I knew it was going to help me. Just tell me the basics and how I can apply them to myself with tips and tricks from your vast experience with that. Yeah, you were teaching me. I hired you to teach and give advice.
Thank you for joining us for this podcast. Mary and Dr. Ted want to remind you to use the internet wisely and to always be sure to consult with your medical provider with any questions or concerns that you may have as you work towards your wellness goals. We look forward to sharing more content with you soon. Thanks for listening.